Hit it. And welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort. All right, here we go. What you think about, you will bring about. Well, hi, everyone, and welcome back to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and we are going to have a really, I think, fun and interesting conversation with Dr. Daniel Gibbs, who is a neurologist who is personally battling Alzheimer's disease. So just think of that, someone who was helping others and is now dealing with that. He has a wonderful book called A Tattoo on My Brain, a neurologist's personal battle against Alzheimer's disease. And before I introduce him, like always, I like to explain to our new listeners who Alzheimer Speaks is and why we do what we do. Bottom line, my own mother had dementia for 30 years, and I just thought it was critically important for us to raise the voice of those diagnosed and those that care for them and who have product, services, and tools, because families and professionals both need this information. We need the insight of what it's really like to live with dementia and how do we best serve those people. So on our show, we talk for about an hour. This is a live show, so you can call in if you'd like. That number is 323-870-4602, and enjoy the conversation as well. Now, we try to bring you sound news, not just sound bites, from real people in the trenches. So keep that in mind, because maybe, just maybe, you could be our next guest. We are always welcoming new people. Just reach out to me at radio@alzheimerspeaks.com, and we'll take it from there. Now, I want to shout out to the Memory Cafe Directory. They are just doing a magnificent job updating all the memory cafes in 5 different countries. And some of them are coming back to meeting in person. Others are still meeting virtual. And some, have just kind of gone on pause. But you can get all the detailed information at Memory Cafe Directory. I also love giving a shout out to Coro Health, that's CORO Health, because they are still allowing people to download 2 of their apps, Music First and Choral Faith, during the pandemic. And then last, I want to give a shout out to Dementia Map, our global resource directory that we just recently launched. And this is free for all users, for people with dementia, for families, for professionals. We don't ask for any upfront personal information. We don't want to intimidate anybody or make them feel trapped. We just want easy access. And if you happen to have a service, product, or tool, or information or a book, we would love to have you join us as well. You can find out more on either side you are at dementiamap.com. And let's see, we're going to hear from the footbar walker, and then I'm going to introduce you to Dr. Daniel Gibbs.
Introducing the life-changing footbar walker.
I'm Peggy from Danville, Kentucky, and I'm 91 years old. The footbar walker revolutionized my care of George. The saving that I made from having to put him in a nursing home came to about $192,000. The footbar walker opens and closes just like a standard walker. The only thing that is different is the top bar and the foot bar. Does that ever make a difference?
Does someone you love use a walker? Do they struggle to get up from a seated position? Are you a caregiver dealing with physical pain and stress as you help your patient? The Foot Bar Walker was designed to assist not only the patient, but also the caregiver. Patients have more control standing up, and no lifting from the caregiver is required. See how it works at thefootbarwalker.com. That's thefootbarwalker.com. Peggy, would you recommend the Foot Bar Walker?
Do I ever? I would not be in the health that I'm in today at this age had it not been for the Foot Bar Walker.
Well, welcome back. And now it's time to reveal our guest and give you a little more detail and get into a great conversation. Dr. Daniel Gibbs is one of 50 million people worldwide with an Alzheimer's disease diagnosis. And he's one of 5.8 million right here in America living with the disease. The difference is that Dr. Gibbs is a neurologist who has spent 25 years caring for patients with Alzheimer's disease himself. He realizes that he, too, might have the disease, even though there's no official diagnosis or serious signs of cognitive decline had occurred. So how did he come to that conclusion? We're going to find out. We will find out today as he tells us his story. We're also going to hear about his book titled A Tattoo on My Brain, a neurologist's personal battle against Alzheimer's disease. Dr. Gibbs' stories are going to warm your heart and inspire you as he shares how one scientist reckons with the disease. He has spent most of his life studying from the outside, looking in, and now he finds himself with a front row seat on the inside of the disease. So welcome, Dr. Gibbs. Thank you so much for taking time to be with us today. I really appreciate it.
Well, I'm happy to be here with you.
Now, I always ask, everybody, and this is kind of funny, if you've been personally touched in your own family or circle of friends with dementia, and I'd still like to know that if you've been surrounded by that. But then also, when did you start noticing signs yourself that concerned you?
Well, I had no obvious family members with Alzheimer's, but both of my parents died early. My dad died of cancer at age 60, and my mother was in her early 70s. So it really wasn't on my radar screen. With a little post hoc digging that I did once I had my diagnosis, I did discover more distant relatives that almost certainly had Alzheimer's. But as I say, it wasn't on my radar screen. In retrospect, my first symptom of Alzheimer's probably occurred about 15 years ago when I first started to lose my sense of smell. Although at the time I had no idea that might be related to Alzheimer's. And it was very, very subtle at first. I just actually remember the very first time I was walking the dog with my wife and I bent over to smell some roses in somebody's front yard, and I commented to my wife that, boy, this is a beautiful rose, but it doesn't have much of a scent. And she smelled it, says, yeah, it smells great. So that was just kind of a curiosity. And then about a year later, these weird illusory smells called phantasmias. They're pretty rare and not known to be associated with Alzheimer's, but I would smell an odor that was always the same, but with nothing in the real world making that smell. And it was always the smell of baking bread mixed with perfume. Very pleasant. Actually, if you read about phantasmias in the medical literature, most of them are unpleasant, but mine were very pleasant. They would last a couple of minutes or maybe up to an hour. And as I said, there was no obvious real olfactory stimulus. And again, this is just a curiosity. At the time, I was working full time. I had no cognitive impairment. And it wasn't until another 6 years later that I started to notice just some very mild cognitive issues that I wouldn't have thought much about at all. By that time, I was in my early 60s or mid 60s. I had occasional trouble remembering the names of colleagues. I moved to a new office, and I never could learn the phone number of my new office or the address of my new office. But again, I wasn't particularly concerned, except by that time I had accidentally learned that I have 2 copies of the ApoE4 allele, which I knew greatly increased my chance of having Alzheimer's disease. And the reason that I accidentally found that out was that my wife, who loves to do genealogical searches, suggested that we get our DNA tested. And back in those days, they had a lockbox in the results of your DNA that for a couple of neurological genes. And I was interested in unlocking that box and looking, because one of the genes was a gene for Parkinson's disease, and I knew that Parkinson's disease was associated with loss of sense of smell, and I wondered, well, maybe I'm going to get Parkinson's disease someday. But that gene was normal. I didn't have that. But the other gene was the ApoE gene, and I was flabbergasted to find that I had 2 copies of the ApoE4 allele, which gave me a very high chance of having Alzheimer's disease by the time I was 70, or a 50% chance, I should say, and virtually 100% chance by age 80. So all of a sudden, Alzheimer's was on my radar screen, and I had a friend who was a neurologist, a dementia specialist, and I asked him to do some off-the-record cognitive testing with a computerized program, and I did that, and I did very well in most areas, in the 95th percentile, which means I did better than 95% of the people who took that test. But in verbal memory, I was only in the 50th percentile, so just about average, so it's still normal. But there was just a hint there that something was not quite right with my verbal memory. So a couple of years later, I was noticing a little bit more cognitive impairment. So I volunteered for a study. This would have been in 2015 at University of California, San Francisco. That was a neuroimaging study looking at a then new tau PET scan for looking for evidence of Alzheimer's for the neurofibrillary tangles that have abnormal tau protein in the brain. And so as part of that study, I had an amyloid PET scan, a tau PET scan, an MRI scan, and 2 days of cognitive testing. And at the end of the week, I was able to look at the scans, and there was abnormal amyloid there, which was consistent with early Alzheimer's, and there also was tau, which is which appears later in the disease, more about the time that cognitive impairment sets in. But I still had essentially normal cognitive testing, so it was in the mild cognitive impairment range. But the PET scans were consistent with early Alzheimer's disease. And as the years have gone on since then, I've gotten a little bit worse.
Okay. Well, thank you for sharing. That was great detail that you gave us. I had always heard that a lot of people will smell burnt rubber, and a lot of those people have had Lewy body dementia, and they talk about fire or burning rubber. So it's interesting. You had a pleasant smell of, at least, so hopefully it was a good perfume mixed with the bread.
That's right. Yeah. So the Lewy body dementias and Parkinson's disease are also associated with phantosmias, or are clearly associated with phantosmias. Alzheimer's not so much, but I'm not sure it's really been looked into as thoroughly as it has with Parkinson's disease and Lewy body dementia.
Yeah. Well, and I know, my mom lived with dementia for 30 years. And when we did her autopsy of the brain, it came back for sure Alzheimer's, but they also asked about Lewy body and Parkinson's, which we didn't see a whole lot of signs, with that. But it's, I personally encourage people, if you can, do those autopsies, because it does give so much data for us to be able to move forward. And I want to thank you for being part of that study as well, because, that's a brave step to step into that. And a lot of people want to, they want to help. They want to be part of the studies. Many get frustrated because they have to be so stringent in the criteria. But again, we need people to participate in those to help move things forward. With that, I want to ask you also, because I always find this really fascinating too, how did you come up with the title to your book, A Tattoo on My Brain?
Well, I actually came up with the title before I even started working on the book, and then I abandoned the title and came up with one which was not nearly as good, and came back to the tattoo, and what the tattoo means is it has both a literal and a figurative meaning to me. I don't have any tattoos, except
that was
one on
of
my
the
brain.
things I was wondering.
Yeah. I've thought, I've had my co-writer Teresa Barker said you really ought to get a tattoo. I think my wife would have other ideas about that, but no, I don't have a real tattoo. But to make a long story short, I've been in 4 clinical trials or studies. I actually tried out for one other one, but I wasn't cognitively bad enough for it. So, excuse me. But the major trial that I was in was one of the monoclonal antibodies directed at amyloid, aducanumab, which has been in the news recently. And I had a adverse reaction to it, which is fairly common and is usually fairly trivial. But mine was quite severe, although I fully recovered from it. But in the process, I had some little areas of bleeding into my brain and swelling of the brain. And the swelling went away after some months. But the blood left behind an iron pigment called hemosiderin, which will probably be there for the rest of my life. It has no consequence at all. But if I have an MRI scan now, it will probably show these little black dots that are left over from the microhemorrhages. And the hemosiderin really isn't all that different from the ink that a tattoo artist would use. And so that's the literal meaning of a tattoo on my brain that'll be there for the rest of my life. But the figurative meaning is, as I say, I don't have a tattoo, but it seems to me that when you have a tattoo, it's a sign of who you are, and it's putting yourself out and saying, "Here, look at me," and that's how I kind of feel about Alzheimer's disease. I want to not hide in the closet. I want to come out, talk about it, and try to do all I can to reduce the stigma that is so pervasive with Alzheimer's disease and get us able to talking about it, not only in the late stages, but in the earliest stages as well.
Oh, I fully agree with you, and I applaud you for taking that stance, because, the stigma is so just overt, and it's, this is a disease that's invisible on a lot of levels to people, especially in the early stages, and some people are actually taunted and bullied. People not believing that they have them because they look okay. There's so much to deal with when you're dealing with these losses in terms of how you used to participate in life. So again, I think it's great to have the conversation. That's really one of the reasons I started Alzheimer's Speaks to begin with, was I believe people living with the disease have so much to teach us, and that we're going to learn faster, and when we learn together, when we really listen. And so, again, applaud you for that. Now, in your book, you outline some actionable steps that people can take to both prevent and treat the disease. I'm wondering if you can share some ideas on that with us.
Yeah, and as a preface to that, let me just say, from the get-go that whether you're talking about lifestyle modifications or possible forthcoming drug treatments for Alzheimer's, my very strong feeling is that they're going to be most effective if used in the earliest stages of the disease, perhaps even before there is any cognitive impairment. It's important to understand that the changes in the brain, the amyloid plaques, show up about 20 years before there is any cognitive impairment. The neurofibrillary tangles, the tau-containing tangles, show up a year or two or maybe a little bit before that, before cognitive impairment starts. But by the time there's cognitive impairment and we can make a clinical diagnosis of Alzheimer's disease, it may be too late to have much impact on the progression of the disease. So I'm trying to move the conversation earlier, even to the stage before there is any cognitive impairment. And that's really tough, because how do you know that somebody has Alzheimer's disease? And but I think that's a conversation that we have to have, and certainly people with a family history of it should think about doing something actionable early, maybe volunteering for a study. But the lifestyle changes that have been well documented, at least for the first two, and are things that we can do at any time. And the most well-studied one and well-documented is aerobic exercise. So people who get an adequate amount of aerobic exercise, and how much an adequate amount is still not agreed upon. But Jack, my dog, and I try to get 10,000 steps in the hills of Portland every day. Sometimes we don't quite make it. Sometimes we get 15,000 steps. You just want to get your heart beating. So the aerobic exercise seems to be better than just strength exercise, and it doesn't have to be running, but anything, walking, swimming, is good for you, and it's good for everything. I mean, it's good for the heart, for cardiovascular health, obviously, and as well as brain health. But it should be started early. It should be started in midlife or before, and of course, those are the times when we're busiest in our lives, and may have it may not be a top priority to carve out an hour a day or whatever to get some aerobic exercise. But I think it's really important, particularly if there is a family history. So the second one is diet, and the data there is looking pretty darn good that Mediterranean-style diets reduce the rate of progression of Alzheimer's, at least in the early stages, and reduce the chance of getting it. And there have been several diets based around the Mediterranean diet. There's the DASH diet that was, I can't remember what that stands for, but it was designed to treat hypertension or to prevent hypertension. And then there's this diet called the MIND diet, which is, I should have looked up what it stands for. The Mediterranean, I can't remember. But it's very similar to the Mediterranean diet, but it has an extra emphasis on foods that contain a lot of flavonols, like nuts and berries, and of course those bitter green vegetables that a lot of people don't like kale. But that's what I follow. There have been, again, fewer studies on diet than with exercise, but the MIND diet looks to be, where it's been compared head-to-head with a straight Mediterranean diet, it seems to be a little bit better in, again, slowing the progression of Alzheimer's in the early stages. And I'm losing my train of thought. Let me see. I've got an excuse here because I do have Alzheimer's disease, but I'll try to get back on track here.
You're fine. We were talking about the different diets, the DASH, the MIND diet, and the Mediterranean diets, and these are all easily Googleable out there,
right?
To look up and get more information on those. But diet is huge. Exercise. And they're probably two of the biggest lifestyle changes that people, I think, struggle with.
Right.
But when you talk about, protecting your mind, and what is that really worth to you, as these numbers climb, I think it's really critical for people to look at this. And, I hate to say it, but I'm right there with a lot of people in terms of not doing quite what I should with that.
Yeah.
I did find here what the DASH diet stands for: dietary approaches to stopping hypertension.
Right.
I did find that one. I haven't found the MIND acronym, what that stands for there. Oh, here, let's see. Mediterranean dash intervention for neurodegenerative delay. That's what that one stands for.
Yeah.
So,
okay. Thank you.
Are there some other? Go ahead. I'm sorry.
I was going to say that doesn't really roll off the tongue very easily, does it?
No,
it
doesn't. No, and that's why those acronyms are there, because they're just so much easier. Yeah. Are there other things that you recommend for, prevention as well?
Yeah, and let me, if you don't mind, let me go back to the diet for a minute, because I'll forget otherwise.
Sure.
to make this point. The MIND diet for me has been really easy to follow. And that is really a consequence of my lost taste of smell, which has affected my taste. And I think my taste has been, over the last couple of years, impaired in addition to the loss of smell. So frankly, most foods taste the same to me. So I actually find that kale I really enjoy, because that little bitter flavor comes through and actually gives me something to identify. So I guess it's a hidden benefit of the loss of smell and taste, is that I have no trouble eating this diet that a lot of people. Which president was it? Was it Bush who wouldn't eat broccoli, or I can't remember. Somebody didn't like broccoli, and famously, and people make jokes about kale and spinach and broccoli, but do what you can to work them into your diet. Okay, let's go on to the other things. And as we go down the list, the data is there, but maybe not quite as robust, and more controversy about it. Staying socially active does seem to be important, and that is really hard when you have Alzheimer's, because particularly as the disease progresses, but even in the early stages where I still am, apathy is a real problem, and it's not because you're just bummed out because you've got Alzheimer's disease. There's a change in the brain that makes you, and it's probably due to the damage to the prefrontal lobes that are where we get our motivation, or planning, and that's damaged, and so there's just I would just prefer to stay home and read a book. Now with the pandemic, that's been great, but I'm not at all interested in. I don't miss big gatherings with people, and in addition, I have a lot of trouble understanding words when more than one person is speaking. I can't separate two conversations as all of us do automatically. We're able to hone in on one conversation and get rid of the rest of the noise. I can't do that. So if I'm in a room with a lot of people speaking, I just retire because I can't make sense of it. Even if a large family dinner is hard for me. So you have to make a conscious effort to make those social connections, because they are important, but they're harder to do when you have Alzheimer's. The other thing is to stay intellectually active, and I think that's really important, and the data is pretty good for it. And it seems that the important thing is to do things that involve learning. not just retrieving old memories. So they always say that doing a lot of crossword puzzles makes you good at doing crossword puzzles, but it may not do much for your brain. I love to do crossword puzzles, but I try to push my brain a little bit. And when I get to the harder ones at the end of the week, I do the New York Times puzzle while I'm eating my lunch, and by the end of the week they're pretty hard. And oftentimes they'll pop up with a place or a word that I have no idea what it is. So when it's filled in, I go and look that up and try to learn something about that new word or that new geographic place or whatever. So the things that are best for stimulating your brain are things that are putting down new memories, learning a new language. Of course, that's beyond me right now, but that helps establish new synapses and nerve cells connecting with each other in the brain. Reading, I try to read 2 books a week. I can't remember what I've read, but just the act of reading is enjoyable to me, and I think that's healthy for the brain. Just writing this book has been a huge intellectual exercise for me, and I think it's really helped me, stay sharp. So the worst thing you could do is just vegetate and not keep using your mind. Then the last area that are we to 5 now? I may have missed one, but is sleep. And that's kind of a new area relatively new area of research in Alzheimer's. But it does seem important to get adequate sleep. And the mechanism of that may be this, and again, this is a fairly new area, this fairly recent discoveries that there is fluid going through the brain at night that cleanses the brain, if you will, and it removes toxins, and even apparently amyloid is removed to a certain extent. And even if that turns out not to, in animal models, it's very effective at actually causing cognitive improvement. In humans, we really haven't gone that far yet. But it seems that people who get less than six or less hours per week are much more likely to get Alzheimer's than people who get 7 or more hours per week per day, per night of sleep. I've totally bungled that up, but there was a really interesting paper that came out just a week or so ago that looked at, I think it was like 10,000 people in a 20-year period in the UK. It was looking at various health outcomes, but they had information on their sleep, reported sleep, and I don't remember the exact number, but I think it was something like the people who got less than 6 or less hours of sleep per night had about a 30% greater chance of getting Alzheimer's disease than those who got 7 or more hours of sleep. So that's something that I try to do religiously. And it's hard because Alzheimer's itself disrupts sleep. So, once you have it, it's hard to get that important time. But again, this is something that we should be doing in the busy time of our lives when we're in our 40s and 50s. Is not shortchanging our sleep, getting exercise, staying intellectually active, staying socially active, and eating a heart-healthy diet.
Oh, I agree. I'm glad you brought up the sleep component because I'll never forget Rudy Tanzi saying, he prided himself on getting little sleep and being a multitasker. And he said, boy, that just really shifted, looking at his own world. And, as we age, too, people sleep less. A lot of times they're up running to the bathroom during the middle of the night. And so, how do we look at staying hydrated and still not having a full bladder, or digesting food? All of those types of things are things that can help us too or maybe not listening to the news, doing something calming like you read or meditate, or, just quiet time.
Yes.
There's a lot of different things that we can do to change. I'm a big push in terms of staying socially connected and educating people on those changes. You made some great points of, large groups are difficult. Noise is difficult. These are things we can control,
Right.
but we can't control them if we don't have the conversation about them. And
right.
And so I think that that's important. And then staying purposeful, feeling like you haven't lost everything. Like you said, you're reading, you might not be remembering everything you read, but the process in and of itself still has value. And I remember when my mom was in a nursing home, she got to the point where she couldn't read her newspaper. And my brothers would say, well, why are we getting that for her? And I said, because it's part of who she is.
Yes.
Not who she was,
Yes.
but who she is.
Mm-hmm.
And this is important. And, one day I remember I came in and she was reading the paper. She was holding it up, but it was upside down. And there were some people giggling, and it's just like because they didn't understand what was going on and why would somebody do that, because it was important to her to blend in, to have this routine. And so I just asked her if I could borrow the paper. There was something on the back I wanted to look at, and then I turned it around and gave it back to her the correct way. Without scolding, pointing it out. Those things are I think, just critical elements of being good human beings, and protecting and lifting and allowing people to live dignified lives, I think is very, very important to do. Now, the tattoo portion of your book and kind of the meaning, offers that trustworthy perspective of a physician and a scientist who, you seem like you're really grounded in optimism and practical advice, for somebody dealing with this. So how were you able to really strike balance? Was it really by applying this, exercise, diet, staying socially connected, staying active, and, adjusting your sleep? Did those things really help you, or were there other things you did, maybe becoming part of an advocate group or a support group?
Yeah, well, yes and yes. I don't know what's helping me, but I want to do everything possible to not only to help slow the progression of my disease. I know it's eventually going to get me, but I would like to have as many years of good functional life before that happens. So I'm working on that. But I'm also trying to be an advocate and try to teach. So I speak to medical students through the Alzheimer's Association here in Portland as part of a panel of people living with Alzheimer's disease or caregivers. And I talk to anybody who will listen. So all my neighbors know that I have Alzheimer's disease, and I actually wrote a paper for Scientific American that came out a couple of weeks ago about face blindness, and I used the example of three of my neighbors who are young women who all had babies at about the same time, about a year and a half ago, and two of them have dark hair and one of them has blonde hair. And the gist of this article was how face blindness is a very common part of Alzheimer's, but there also is this concurrent face blindness that we're all experiencing due to having to wear masks for COVID-19, and how kind of talking about the intersection of those two things. So, as I say in this brief article, I was out walking on my street, and I came across a blonde woman pushing a stroller with a child in it, and I went over and started talking to her, asking how old her child was at that time, and we conversed for a few minutes. And then as I was walking away, I looked back, and she had the wrong dog. I mean, her dog wasn't the dog that belonged with that woman, and I realized that this was not one of my neighbors. This was a total stranger who I had walked up to and started talking to, and had a good laugh over that. And so I shared that when that article came out in Scientific American. I sent a link to it to the three women on my street, and at least two of them I don't think knew that I had Alzheimer's at that time, and they all were very I think touched that I did that, and that I wasn't in the closet and that sort of stuff, and at least one of them was, she felt like she was a rock star, that she was in Scientific American. So that was kind of a fun thing. But yeah, I do talk to people.
And I like that, even though you made that error, you didn't beat yourself up. You got to laugh out of it. I mean, those things happen to all of us in our lives, and we laugh about them. And so often I find when there's chronic illness, such as dementia, people forget to laugh, and I mean, we all do silly stuff. I mean, it's going to happen. None of us are perfect, and I think having a sense of humor can go a long way, in no matter what we're dealing with in life, and it isn't any different with dementia. I think the other thing is that sometimes care partners take things so seriously and they forget to laugh, with their loved one or their friend. Yeah. And that's, I mean, to me, that's a critical piece that's very attractive to me in any relationship. I love to laugh, and as I think most people do. And so don't forget the simple things that add so much value to our lives. I think that's very, very critical. The other question I wanted to ask you was, you had mentioned genetic testing and, maybe doing that early. What do you think? Should people do that or not? I've heard people on all different sides of the board with this one.
Well, that's a complicated question, and I'm not a fan of undirected genetic testing. I think that if you're going to do it, it ought to be under the guidance of somebody who can tell you what it means, and what to do with that information. Now, for somebody with a family history of Alzheimer's, a parent or a brother or sister with a first-degree relative, of course, that's going to increase their risk more than anything for getting it. And those are the people who I would encourage to, for one thing, start doing those lifestyle changes, whether they find out whether they've got a gene or not, because it's good for you, even if you're not going to get Alzheimer's. But also to consider about volunteering for a study, because there are a number of studies out there now that are, trying to find people who don't have clinical signs of Alzheimer's, don't have any memory problems, but are on the road to possibly getting it, because we're starting to do studies to see if we can prevent it. And I think that's where the sweet spot's going to be in finding a drug that works for Alzheimer's, is getting something to use early. So, that's a long-winded way of saying genetic testing is not for everybody. But for people with a family history, then I would suggest, if they're interested in doing something about the treatment for Alzheimer's, is to volunteer for a study. And I love being in studies. I mean, it was a gas. I mean, it was entertaining. It was mentally stimulating. Some were more interesting than others, but But I should also say that I don't think it's a good idea to join a study with the idea that this is what I'm going to do to get a cure. I mean, for me, because if you have that attitude, you're likely to be disappointed, The chance of one person benefiting themselves is small. But as the Alzheimer's, they have a great slogan that says the first person who survives Alzheimer's will be in a study. And that's probably true. So somebody out there is going to take that drug that works and be one of the first people to survive. I've forgotten where we started on that. Can you bring me back on point?
No, you did a great job. We were talking about just your thoughts on getting tested, and I do want to bring up too, because some people are not doing this under doctor's guidance, and they're not getting kind of that genetic counseling prior to doing that. They're just doing these kind of things that are shipped out to us, and then all of a sudden, they're thinking maybe they're looking for something else, and then all of a sudden, oh my gosh, I've got this gene, and that is not how you want to learn about this stuff.
No, not at all.
And I think people run out and take this stuff without really thinking of the lifelong implications of, now that I know that, what does that mean? And kind of like, my philosophy is, and I have not, I'm one of those that have chosen not to, even though my mom has lived with it. And my rationale is that I'm a firm believer that we probably all have the cancer gene in us, or one type of cancer gene in us, but that doesn't mean it's going to mutate. And if I knew that, I think it's easy for people to go down the rabbit hole and believe if I have it, it's going to mutate, it's going to take over my life, and they start focusing on everything that they're going to lose when they haven't even lost anything. And again, when there's some easy lifestyle changes that people can take, because any of those things that you mentioned before, the exercise, the diet, staying socially connected, staying active, watching how much sleep we're getting, those things are good for all of life, not just fending off dementia. Same with how we interact with people and how we treat people. The lessons that are learned through dementia are good worldwide on all levels, all generations, all cultures. I just, I've kind of twisted the disease myself to look at it that I really think dementia is here to teach us some really significant, important human lessons that we have sidestepped. About what it means to be, humane, what it means to be kind, what it means to even find joy. It doesn't have to be big and splashy and look good on Facebook to fill your heart. But we've gotten trapped in those things. And to me, my mother's 30 years was probably the biggest gift I'll ever receive. Though I will be the first to admit it came in a very strange package, and one that I never thought would deliver that to me. And but again, you're not going to find what you're not looking for. So if you feel hopeless and you feel disconnected, that's going to have a huge effect. And that's why it's so important for people like you and others to step up and step out and say, this is what I'm dealing with. This is, because we're not going to be able to find a cure, let alone find caring support that is needed if we don't have real conversations with real people. That's just the bottom line, because we're not going to know what to deliver. We're not going to know what is needed. And so we really have to learn to take that fear out. And I think your book does that in such a nice way. It's optimistic. It's hopeful. You really emphasize that the disease itself is not a hopeless situation. And, people don't typically hear that. You talk about advocating for the proactive steps that people can take to decrease their risk or to slow down the progress. Or, I would even add in your book the ability to increase our connections, with our relationships and really figure out what's important. It's kind of, anytime someone gets a chronic illness or, something that says their life could be called shorter, people create a bucket list. And a lot of times, again, that's big, flashy stuff. I want to go on this trip and I want to do this and I want to do that. And I'm not saying that that's wrong, But look at your relationships. You know, what do you want out of those from both sides? Because, you know, dementia doesn't just impact the person who's diagnosed. It has a huge ripple effect to family and friends and coworkers and just people you bump into into contact with in the community, at the bank, at the library, you know, at card club or wherever it might be, at church. You know, this is not something that only affects a select group of people, and it knows no boundaries. And so it's important for us to take this seriously and to step up and address what is real, and to like you say in your book, you know, give hope. You know, let people know they are still part. They are still part of this world, and they are still important. You know, to me, that's just very, very critical pieces. I wanted to ask for you, what was kind of the most difficult thing that you had to tackle once you confirmed, yep, this is what I'm dealing with?
Well, I guess the thing I was most ambivalent about was how to talk to my children about it. Because, you know, I have 3 adult children, 4 grandchildren, and because I have 2 copies of ApoE4, that means they all have at least 1 copy of ApoE4. And I wanted them to be aware of that they carry a risk factor and what that means. And you know, we've had, to varying degrees, we've had conversations in depth about their potential risk and what they should do, when they should be tested, if ever, and I've tried to make them more get some enthusiasm for eventually volunteering for studies, because they're exactly the sort of person that studies are looking for. Perhaps in another 10 years or so, they're all still in their 30s. But that was something I gave a lot of thought to, you know, how to bring them into the picture.
Well, yeah, because that's a scary piece to discuss, you know, that can turn their world upside down too, in terms of what does this mean, you know, for us. And the sooner we can all honestly have these conversations and understand, again, you know, this can happen to any of us, you know, the better off that we'll be. When it came to, you know, telling friends and things like that, and even your children, did you do that right away? A lot of people hold back and, you know, aren't comfortable with that.
No, we tended to do it, and, you know, the most common reaction was, no, you don't have Alzheimer's disease, because, you know, there was nothing outwardly apparent, at least a year or 2 ago. I remember some very good friends of ours that we went to college with, that we see once or twice a year. They live in San Diego. We were down in San Diego actually shortly after the misadventure with the drug trial, and I did have, you know, some increased cognitive problems that have since improved. And we were in a restaurant, and I asked my wife to figure the tip, because I just couldn't do it, and so I explained, you know, I have Alzheimer's disease, and they said, what? Because, you know, they would have no idea. But, you know, now all those people, you know, all our family friends, and right now they're, you know, pre-ordered the book, and you're quite interested in the whole journey, and it's been interesting, yeah.
Well, and I think, you know, like you said, when one of the most common things is, no, you don't, you can't. And some of that is because they can't see it, you know. A lot of these things are hidden unless you're with somebody 24/7. And they don't realize that, like everyone, a person with dementia wants to fit in. So we work really hard, no matter what our deficits are, to fit in with the group. And so our social skills really take over. My mom was, she was a genius at that for a long, long time. And yet, it makes me laugh when people go, well, no, you can't. And it's like, do you think this was easy for me to bring up? It's not April Fool's Day. And yet that is such a common response, which just to me says how far we have to go in terms of educating people, about this disease. Yeah, sometimes I feel like I ought to carry around a copy of my PET scan so I can show people, yes, I do have it. Trust me, yeah. But again, this is the way, we teach people. One thing I didn't mention when you were talking, which again I think is really important too, you talked about some people have a difficult time with facial recognition and, the facial blindness. And one gal, I don't know if you know her, but Truthful Loving Kindness has been living with dementia for many years. And, she talks about not being able to recognize her husband by looking at him. Like if they go to a restaurant, she goes to the bathroom, and they can have a booth right outside the bathroom door, and she'll look around, and she does not have a clue who what table do I go to until she hears his voice. Right. And these are things that we have to talk about to make life more comfortable for everybody, and less fearful, because how spooky could that be? Yeah. Well, some people, about 2% of the population is born with congenital face blindness. And I know one of my former colleagues that's a neurologist who can't recognize anybody until they speak. And she's in her 40s probably. And you just adapt, but it's when you lose it, like with Alzheimer's, it's very common in Alzheimer's. It does add one more fraught thing when you can't tell who's who. Yep, Greg, exactly. I don't know. Do you know Greg O'Brien? Has he been on your show? Oh, yeah, years ago, before he was a big whoop-de-doo there, he always was, and being a writer and stuff, but now he's really well known as an advocate. But he's written about his face blindness and just not being able to recognize, close friends, when they come up to talk to him. But, yeah, and again, good things for all of us to learn about and to know. I do want to just mention to our audience that the book you can pre-order at this point, and that is on your site, if I'm not mistaken, tattooonmybrain.com or tattooonmybrain.com. And so, and people can go there and click on the contact button too if they would like to talk with you further. And I would encourage people to get this book. I think it really is a worthy read. And for a lot of times communities and conferences are looking for a giveaway piece and a speaker. I think you'd be excellent, absolutely excellent. You've got wonderful insights and really paint a truthful picture of what the disease looks like, feels like, and what it can be to go through this process. So, again, thank you so much. We've been talking with Dr. Daniel Gibbs, and again, his book is A Tattoo on My Brain, and you can get that on his website. www.tattooonmybrain.com. Thank you, everyone, for listening, and I wish you a wonderful Mother's Day for all those that are mothers or who mother. Many people out there, we wish you nothing but the best, and if you have any questions or would like to be our next guest, reach out to me at radio@alzheimersspeaks.com. And don't forget to visit our site. We have lots of resources there as well. And again, speaking of resources, check out dementiamap.com. Thank you again, Dr. Gibbs. It's been a pleasure.
Oh, my pleasure. Thank you.
Thank you. Bye now. Hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform.